May I request Dr. Arima Mishra to give the keynote address on the overview of governance in healthcare. Arima Mishra is a trained social scientist from the Delhi School of Economics, Delhi. Currently, she is on the faculty in the institute. She has 12 years of research experience examining several thematic areas in the field of health policy and systems research. Recently, she has been involved in steering the country component of a multidisciplinary research project on health system stewardship and regulations in Vietnam, India, and China, supported by the European Commission. She has also been collaborating with the University of Oslo to research on health system strengthening within vaccination initiatives and explaining differential immunization coverage in India and Malawi. She has several peer-reviewed publications, including a recently edited book on health, illness, and medicine, ethnographic readings published by Orient Black Swan. Arima, please.
Thank you, Professor Baru, and good morning, everyone. I am going to kind of reflect on health system governance, research needs, and reflections, largely from a researcher's perspective. What I will do, I'll basically take you through three main issues. One is that why and how governance has become so important an issue to debate about right now. Second is what we mean by governance, how much do we know about governance, more from researcher's point of view again. And third, I'm going to briefly reflect on an empirical study which we've just concluded to supplement the points that I would have discussed before. Now to begin with, why governance? Well, governance matters. This might sound familiar because this is the title of a couple of publications. Now, way back in late 90s, the former Secretary General of the United Nations says that good governance is perhaps the most single factor for eradicating poverty and promoting development. So governance is considered as key to economic growth, overall development, evidently including achieving Millennium Development Goals. Following from this larger postulate on the need for governance, good governance of the whole society, is what we are going to talk about, why health system governance matters. I don't think that governance is a new concept or a new theme, but health system governance, both as a concept and as a thematic idea, is probably more sharply articulated in the recent times than ever. And this is considered as a central concern on certain grounds to say that it comes with the realization that mere infusion of resources, be it finance, be it human, be it technical, may not guarantee health system performance. So you need good governance actually to measure health system performance, to ensure accountability, and to achieve health systems objectives, that's equity, access, and quality care for all. This kind of increasing significance of the role of health system governance in the policy and health systems research is also reflected in the health systems analytical frameworks. So for example, the 2000 WHO report talks about governance in terms of stewardship as one of the 4 main health systems functions. In 2007 report, it modifies and sharpens governance, not in terms of stewardship, but it talks about leadership and governance as one of the 6 building blocks. It also expands its meaning from stewardship, which essentially implied good, proper, efficient management for the well-being of the whole population, to ensuring that the strategic policy frameworks exist with appropriate regulations, with building coalitions, with accountability. And it not merely talks about that it has a central, it is one of the 6 building blocks, but the fact that it operates in its own right and it oversees and interacts with all other building blocks. Having said that governance and health system governance matters to achieve health systems objectives and outcomes, what do we mean by governance or health system governance? I'm not raising these questions in definitional terms. I'm raising these questions more in terms of how do you concretize governance in methodological and empirical terms. What do I go and study when I said I'm going to study and research on governance? Because it's a buzzword, but it's also its kind of umbrella concept. It may mean a lot, it may not mean anything. So it's how do you actually concretize in empirical contexts? You have a number of assessment frameworks, WHO, World Bank, UNDP, PAHO, but all this actually needs detailed, in-depth empirical investigation. Also, let's remember that governance or good governance is not a value-neutral concept. it is value-led, and it has a political function. It may mean, it may not mean, it may mean different things in different contexts. So it is culturally embedded, and that necessitates further that we need to have empirical studies on governance. We have a framework, which actually builds up on all other previous frameworks, that is Siddiqui et al.'s framework 2009, which talks about, okay, so how do you assess governance? Through 10 principles. Now, these 10 principles, I think this is a guiding framework, not that it answers you what is all about governance, but what is good about this framework is that through these 10 principles, it at least unpacks that very curious and mysterious concept called governance in terms of specific components of it. And if you look at, so for example, one principle, strategic vision, it tells you, okay, with strategic vision, what are the questions that are at stake in this principle? So for example, strategic vision, we are asking, okay, so where does health figure in the whole development priorities and policies of the state, of the country? Do you have a legal framework that ensures health is a matter of right? What kind of policies that are in place to ensure that within a given time frame, the health system achieves this 1, 2, 3 objectives? What kind of mechanisms are there to actually then make sure that these policies are implemented? So what it does is basically tells you through these principles a set of broad questions, which again lead to very, very specific questions once you start unpacking each of these principles. Also, is that what is good about this guiding framework is that not all these principles will be equally kind of relevant in all contexts. You can include, you can take out some depending on what suits in what particular context. Also, is that not all these 10 principles are sitting all in isolation. All are actually related to one another. You can't talk about accountability without having a strategic vision. You can't talk about responsiveness without having accountability. Also, the moment you ask these questions and start unfolding each of these principles, it takes you to a kind of framework when you are trying to do research, is that what is involved is certain key components. Is that governance is not a concept which is headless or toothless, right? So it's all about relationships, it's all about power relations among different actors. Who is taking the decisions for whom, who is involved, and what is being decided and how this decision is being carried out. So the moment you start teasing out these questions, what you are actually pointing out towards is that the role of actors and different kinds of actors who are involved in this decision making and implementation frameworks, including those who are being affected by this governance framework. So what it leads to, if I juxtapose the health systems framework with the Siddiqui's principles and taking it a little further in terms of empirical studies, is that what you get is the role of actors, process, that is mechanisms, processes, institutions, and context where it actually operates. And the fact that all these principles actually permeate the whole system, health system. With this, I could take you, because once we acknowledge that health governance is a complex subject, well, I can't then afford to leave here saying as complex and as obscure. So I'm going to elaborate this through a specific study which we just completed. This is called Health Systems Stewardship and Regulations, Vietnam, India, and China. Supported by the European Commission, and this is between 2009 and 2012. It just got over. And what we looked at is that if you really need a very in-depth analysis of what is governance, how does it operate through any kind of principles lens, it is very important to have a very focused unit of analysis. Then only you can get a lot of things about specific context, how it operates, where it goes, what are the weaker areas, what are the pitfalls, and what are the strengths. What we focused on is regulations as an instrument of governance. We focused on 3 sets of regulations, again, to see, and the questions that we asked broadly is how do regulations, and through that of governance, affect delivery of access, equitable access to, not delivery of, ensuring equitable access to quality care. Again, for a more in-depth analysis, we focused on maternal health care, and to look at what kind of regulatory frameworks, what kind of regulatory architecture that you have to ensure this kind of objective. So we focused on 3 different regulations. One on emergency obstetric care, so we looked at Indian public health standards to make sure that EMOC care is ensured. Second is Medical Termination of Pregnancy Act to ensure safe access to abortion services. And the third one, which is not really a part of the mainstream, unfortunately, neglected and not part of the mainstream health system regulations in the Consumer Protection Act, to say that how does this external accountability mechanism, where people demand accountability from the state, how does that work? This study is actually, it involves 6 country partners, 3 from Asia, that is India, China, and Vietnam, and 3 European, that is ITM in Belgium. We have our colleagues here, and KIT from Amsterdam, Netherlands, and the third is Leeds, University of Leeds in UK. What this methodology actually did with that Siddiqui principles is that we entered the field to look at how do regulations as an instrument of governance operate through a largely interpretative inquiry. What it means is that we try to ask ourselves, how do regulations operate in everyday contexts and practices? How do different actors who are involved actually interpret and negotiate regulations objectives, regulations policies, regulations mechanisms? Not merely how do they interpret and negotiate, but what happens to that, and what happens after that? What kind of effects do these kind of negotiations lead to, and why, and how can we talk about it? What lessons to learn from there? What we did is actually we captured at different levels, beginning with the national level. How do these regulations, how have these regulations come about, with what kind of objectives, how, to what extent is it informed by evidence, and whether it was context relevant or not, and how dynamic are these regulations to respond to the kind of changes that happen both in the health system and in society at large. And also, so we moved from the national, state, district to local community level. Of course, for this kind of inquiry, we had to juxtapose different kind of methodological tools, to begin with the content analysis of all these regulation documents, to observations of events and meetings, to actually see how power relations operate in real life contexts, and to in-depth interviews of 94 actors at different levels. This is the kind of conceptual framework, and I think this is actually led by, this is the Consortium Framework, and I know ITM, our colleagues sitting here, who had a major role in framing this kind of conceptual framework. It's the same the kind of ideas that I'm talking about. It reinforces, it enables you actually to look at governance, how it operates at different levels. What it leads to, this kind of methodological inquiry, then it leads you to unpack governance. And it gives you actually a very grounded approach to what it means to governance, what it means in terms of governance, or any principle of governance, through the lens of different actors and processes and contexts. And also what we realize that the regulations, the way that it is interpreted, it's largely, again, it relates to the larger cultural, political, economic context. And hence regulations, for example, I can give one example, were largely interpreted as a control mechanism. And so in largely in a derogatory context, and rather very little in terms of constructive learning and supervision. And also is that, let's also remember that health system governance is not just one topic or something, it's also about values that we are talking about. So health systems is influenced by and also generates wider societal value. And so what I would actually end with saying that we need more empirical research to understand what is governance before we talk about what is the role of governance, whether in terms of health system strengthening, whether in terms of achieving universal health coverage. The significance is well kind of acknowledged, but I think the complexity needs to be decoded. And that is why we need much more the research in terms of more methodological sophistication and analytical rigor. And hence, I would call for more focused empirical studies to identify specific issues and means to address and redress. Thank you.
Thank you very much, Arima.